Hi, I'm Carrie Johnston and I'm a student nurse, and today I'm going to be demonstrating the nasogastric tube, inserting and removing, administering medication into it, and also hooking it up to gastric decompression. And my first check is going to be the MAR and the provider's orders. Okay, so I have Shirley Cost on the MAR and the provider's orders, and I have her date of birth as 4/3/87 on the MAR and the provider's orders. And I have benzocaine hurricane 1 20%, a one-time use, and that's a spray, and I have that on the provider's, on the MAR and the provider's orders also say hurricane 1 spray PO before inserting the NGT tube. Okay, and then I also have Ativan 2 milligram tablet PRN for anxiety, and I also have that on the order as Ativan 2 milligram tablet per NGT PRN for anxiety. I have it on both here. Okay, and then she's here for a small bowel obstruction. Okay, and she's allergic to penicillin and furosemide. So for my second check, I'm going to check the spray with the MAR, and I have benzocaine hurricane 1. It says a one-time use, or one-time spray, one spray, and on the benzocaine spray can here I have the same thing, and I have an expiration date on here of 12/2023. Okay, and then I have the Ativan also, and that is a 2 milligram tablet, and it has an expiration date of 12/23, and that's for anxiety. Okay. Okay, so now I'm going to, that I did my first and second check, I'm going to be going into the room with Shirley. Hi Shirley, I'm Tara Johnston, I'm a nursing student. Today I'm just going to be checking your bowel sounds, and it seems that you have a bowel obstruction. But first, can I get your name and date of birth? Okay, and that matches with my MAR. I have Shirley Cost, 4/3/87, and the bracelet also says 4/3/87 that she's wearing, and Shirley Cost. So I'm just going to assess your bowel sounds here. Okay, assessing each quadrant. Okay. And then I'm going to be checking your nair to see if you have anything obstructing it right now. Nope, no, I don't see anything. Have you had any nosebleeds recently, or nasal surgeries, nasal inflammation, or nasal polyps? No? Okay. Okay, so then I'm going to be checking her gag reflex, and I'm also going to be spraying the benzocaine spray so that I can numb her throat for the procedure. Hi Shirley. Okay, I'm just going to check your gag reflex. Oh, yep, she's got a good gag reflex. Okay, and then I'm going to be spraying the spray on the back of the throat. Okay. And then Shirley, I'm just going to give you your call right here. Well, I'm actually going to be here preparing supplies here. And I'm going to give 15 to 20 minutes for that to numb your throat. Okay, so I'm going to do that. Get my gloves and hygiene gloves. Okay, Shirley, I'm just going to lay this across your chest here. I'll give you a cup and your water. Like that, ready? Okay, and then I'm going to have this Kleenex here. And then I'm just going to take a measurement of the tubing. this from the nose to the ear. And then I'm going to take the ear down to where I feel the chromium process and build there. Okay, and then I'm going to take my tape and I'm going to tape that area, which I have it at 64 centimeters. Put my tape around that there. Okay, Shirley, I'm just gonna check your mirror, and then I'm also gonna put the in case there's gas content that comes out. So which nostril do you think would be better? Could you blow out of this side? Blow out of that side? Okay, it seems like the left side would be best. Does it seem like your throat is numb now? It's been 15 to 20 minutes? Yeah, that's okay. Okay, so then I'm going to get my spray here and spray. It's actually lubricant, so I'm putting lubricant on there. So Shirley, at any time during this process that you feel like it's hurting or you want me to stop, just blink or raise a finger to let me know when to stop. Okay. All right. We're going to tilt your head back, Shirley, and then we're going to start to insert here. Okay. Now we hear a gag reflex, and then we bring it out at 1/8 of an inch. And have Shirley bring her head down, give her water, and bring your head down, Shirley. So with her head down, then we're going to continue to insert while she drinks. Swallow, swallow, swallow. Okay, Shirley, keep swallowing. Of course, her head would be down right now, but I can't hold the glass and so she can't hold it. Swallow, Shirley. Swallow. Okay, and that's as far as it's gonna go there. Then I'm gonna take my tongue depressor and my light, and I'm gonna check for recoil. Okay, which is fine, there is none. And I'm gonna take my nose peel. Oh, I'm gonna use my alcohol pad first to get any oils off the skin. And I'll put that on there. Wrap that around. Okay. Okay, and then I'm going to take my marker, like say this is my marker, and I'm going to mark it around here, and so it's 45, 43, so I'm going to document that. And I'll take my closing pin and pin it to her close. And I haven't heard any like gurgling sounds or anything with her lungs, but I'm just going to take a peek here at her lungs and see if I hear anything. Okay. And they sound fine, so that's okay. Are you feeling okay, Shirley? Yes? Okay. And so now I'm going to get my gastric content out of here. And put the plug on there. Then I'm going to get my med cup. I'm gonna put my gastric juices in it. Okay. And then I'm gonna take my pH paper, and then I'm gonna put it in there, dip it in there, and I'm gonna compare it to the pH chart. And it did fall between the 1 to 4 for gastric juice. Okay. So I'm going to take my measuring thing and I'm going to measure from the 44. Well, I'm going to clip it for right now before I call radiology. I'm going to measure from the 44 down to the end of the numbers here. And we have so we have 37 centimeters. And then we're going to document that. Then we're gonna have call for x-ray to come and check out, and we got our x-ray things back, that everything came back good with that. So then we're going to, now that we have everything back saying it's in the right placement, we're gonna take her and hook her up to the suction machine. So we would unplug this. And then we would plug it in here. And then we would turn it on from medium to low for approximately 20 to 30 minutes, but we would keep checking on her. And then, okay, so the next one I'm going to do is I'm going to get rid of my gloves and put them in the garbage, and get new gloves. So I have new gloves. I'm gonna unhook her from here. Okay. And then I'm going to do my medication administration with have my fresh gloves on. And the doctor called and ordered her an Ativan for anxiety. And so I'm going to get my medication. I'm going to crush my medication. Well, I'm going to compare it with the MAR. Again, I have an Ativan 2 milligram PRN for anxiety. I'm going to crush it up. And then I'm just gonna compare with Shirley's armband here that she has. You know, Shirley can verify your name and date of birth. And then it verifies with the MAR here, Shirley crossed 4/3/87. Okay. And then my medication is crushed and mixed in there. So I'm going to take I have my water measured out for my flushing. So I'm going to hook this up to her, take the valve out, put it in here. And then I'm going to flush with 20 to 30 of water. Actually, we're going to crimp it first. We're going to crimp it first and then put 20 to 30 to water in there. And then we'll let it, gravity take it down. And then I'm going to crimp it again. And I'm going to put my medication in there. Okay. And then I'm going to let that flow down again. And then I'm going to put my water in here. Okay. And then I'm going to let that flush. Okay. And then I will take this out. Plug it in. Okay. Okay, and so then the medication, I'm going to document it, and then after the first one I would have documented the color and the characteristics of gastric juice and her lung functions, and I would have signed for the benzocaine. I would have signed for that, documented some characteristics of the digestive juices and also her lung sound. And then after this medication, I would also document her bowel sounds here. I'm just gonna check her bowel sounds again. Okay, Shirley, I'm just gonna check your bowel sounds again. Okay, for all 4 quadrants, and it seems to be sounding good. And okay, so we're gonna get ready to remove the tubing. So at this point, I'm going to hook this up so that we can administer air. 10 milligrams of air. And I'm going to try to get the tape off first before I do that. Okay, our 10 to 30. What's 10 to 30? And then I'm going to try to get the tape off here. To remove that. It's really on there, Shirley. It doesn't want to come off. Okay, so I got that removed. Okay, and I have fresh gloves on now. And I did my hand hygiene, so I'm going to get ready to. Shirley, I'm just going to flush some air in here, and then I'm going to have you take some really deep breaths, and we're going to remove the tubing. Okay, I flushed my air in here. Okay. And then I'm just going to, a couple of deep breaths, Shirley. Ready? 1, 2, 3. Garbage, and then give her a washcloth for her face. Here you go, Shirley. Okay. And then Shirley, I'm going to give you a call light, and I will come back to check on you in 15 to 20 minutes and see if you're doing okay. And is everything okay, Shirley? Yeah? Okay. Here's your call light, and then put the bed down, and I'll be back to check on you.